So good morning. I'm going to do an Ezpap. So the first thing I'm going to do is check the patient's charts. And when I'm ready to go in the room, then I will gather my necessary things. If I need to take the Ezpap in with me, if I haven't used it yet, then I'll knock on the patient's door, introduce myself, and then I'll check the patient ID band, wash my hands, and assess the patient. So I'm going to check their vital signs, and then I'm going to listen to their lungs before I do the treatment. So when I'm ready, I'm going to set up the treatment. And so here I have an Ezpap. And so if I need to check their inspiratory flow rate, then I need to connect the manometer. So I'd remove this valve and I connect it to there. So every Ezpap comes with a disposable manometer. So we're gonna place it onto there. And then I need to set it at the appropriate flow where I think they should be at and see if they can get there. If they cannot, and then we will work our way up with it. And so with this, you connect it to, an Ezpap needs to be connected to an oxygen source to be working properly. So when you're ready, you place it on there, make sure it's tight on there. And so then you would tell the patient, tell them about what this is gonna do. So this is gonna help them loosen up their secretions in their lungs, and it'll help them clear it out easier for them and strengthen up their lungs to clear out their lungs, to cough up anything that they need to. So when you're ready, you come over here. You connect it to an oxygen source, place it at least 5 liters per minute, and then you instruct the patient not to obstruct the end piece when you're holding it, as it will not get the appropriate flow to do the treatment for them to get the secretions out. So you'll have them hold them like this and not upside down, because that can mess up with the manometer especially. So you're gonna have them take a nice deep breath in, and then exhale. So you're gonna have a 1-to-3 to 1-to-4 ratio with them, and then you'll have it do it a few times. And if they feel lightheaded, then you'll stop and give them a break. That way they don't don't pass out or anything on you. And the nice thing about the Ezpap, you can do this along with your nebulizer treatment. So there would be another adapter on the end, and then you would have a medicine cup at the bottom here for that treatment, and then you can either do a mouthpiece, and they can also come with a little mask, the cover, to help them if they can't quite get the tight seal around the mouthpiece. So when you're done with this, you would shut it off, remove it from the oxygen source. You would dispose of the manometer because it's disposable, so you don't want to use it again because you can get moisture in there from the treatment. So you're going to remove your tubing from there, the oxygen tubing. That way you can use it again, set it in an appropriate area to keep it sanitary. And then this, when you're done with it, cover the port where the manometer was, and then you would let this air dry and instruct the patient not to get it wet, as it can ruin the inside of the little valve, and you want to air dry it. So when you air dry it, then the mouthpiece you can take and sterile water, you can wash it with sterile water and air dry it out on a towel. So when you're done with the treatment, you would have them do it a few times, and then if they're doing okay, then you go and check their vital signs after you've done the treatment, and then listen to the lungs. And then if they always have them do a nice deep cough, so that way if they have any secretions, they can cough up the secretions, and they can cough it into a basin if they cough up anything, or if you would like to, the doctor would like to see kind of what the labs show with it, and then you can take it to lab. But when I'm done, I would wash my hands, set everything, and then I'd have the patient reposition the patient, and then go chart on their charts of what I have done.